I think Commissioner of the BZA goes by that clock.
Oh, do they?
Yeah, you know they do it wrong.
Gives everybody a couple minutes, right?
That's not Apple time, and that's what our broadcast goes by. So, all right, I think we'll get started. I'd like to welcome everybody to our now bi-weekly press conference. Today, our guests are Tina Fugate, who's a nurse, RN, BSN from MedStat, Wellness Center Director at KCH, Lutheran Health Physicians. She's going to talk about testing here in the community and anything else she wants to talk about. And then obviously our standard is the Kosciuszko County Health Department. Teresa Reed will be giving us a lot of updates on local our statistics, where we stand right now, and then talking about the importance of as we head into school starting. We'll have a lot of discussion about that today. So I think we've got a lot of good information coming out today. I just want to start with my usual update. Not a whole lot new, other than just want to reiterate State Department of Health testing, mobile testing sites have gone away for the time being, and we're now relying on our local CARES Act funded testing sites, MedStat, which Tina will talk about here shortly. And through August 18th, they've done just under 500 tests. So there's quite a few people taking advantage of those testing sites, of which there are 3 in the county. The majority of the tests are done here locally. MedStat is open 7 days a week here for testing. I believe it's 7 to 8 Monday through Friday, and 8 to 4:30, 8 to 4 on Saturday, Sunday. So provides a very ample window to get that testing done. And that testing, again, and we'll talk a little bit about this, but the testing's for ages 2 and up. And it's a good idea to get on medstatonline.com to pre-register, set an appointment up, get all your insurance information taken care of. If you don't have insurance, again, that's what the CARES Act funding will take care of. So, but it's good to get pre-registered so that you don't have to wait a long time when you get out there. Parkview Hospital started their testing this past Monday. You need to call the hospital front desk, which is 372-0030, to set your appointment up. Their hours are 8:30 to 5, Monday through Friday. Again, it's best to call ahead, but that's also CARES Act funded testing. So we'll again get a little bit more detailed with Tina and MedStat here shortly. I do know that the city and county will be working to potentially set up another mobile testing site in the future. We've got a resource in Elkhart County that may be willing to come down and maybe do a Saturday mobile testing site. So we may want to use that in communities in areas that have been impacted more than others, to try and improve accessibility to that testing. I did talk to both Dr. Hofford and Dr. Cadup yesterday, and I think they both remain cautiously optimistic with school getting started, but understanding that they've worked very hard with the protocols that they've set up in conjunction with the health department. And again, we'll hear a little bit more about that, but it was good to hear their voices. I think they were happy to have people back on campus and in the classroom, and now the challenge is keeping them there, and hopefully we'll respond to that, and we'll do good. So again, today's focus will be on testing and the resumption of school. I do want to continue to reiterate the wearing of masks. I still in my heart believe that if we wear masks, there's not much chance we'll have to go back to a stay-at-home order, but that's my opinion. But I think the science will tell us that masks work, and that's probably the easiest and best thing we can do. So I would ask for that continued wearing of masks in public places. So, Teresa, I know seems like our testing has slowed down a little bit with loss of State Department of Health testing site. Looks like our 7-day positivity rate improved a little bit this week, so with that, I'll tee it up for you, and you can give us the health department information, talk about schools. Microphone's yours.
Okay, thank you. Well, as an overview right now, Kosciuszko County, 888 cases over all these months. That gives us a 1.1% positivity rate. So, or 1.1% of our population has been diagnosed with COVID at one point over the last few months. So that's still a nice low number overall. It's a lot less than what I was afraid this was going to be when this all started back in March. In the last 4 weeks, we've had 4 weeks ago, there were 97 cases, then there were 60 cases, 32, 34 cases. So like the way those numbers are trending, and that's still been maintained with a positivity rate of 5.8% from the state site this morning, with 9,884 tests according to the state site. So that means right now we're still running 94 of 100 people are coming back with a negative test when they're tested. So I'm pleased with that. Now, the positivity number, one of the things that we need to realize is that while we have testing available, nobody has to go without testing, but without that being quite as easy as a drive-through, we'll see that positivity rate go up a little, and that's just because people aren't testing as much for curiosity. So we'll want to watch that. Positivity can tell us if something's going wrong, but by itself, it tells us some things, but not everything. Kosciuszko County has a little 1,117 cases per 100,000 people. So that would be an increase of our case rate. But we can use that toggle switch on the state site to give us an idea of how we're doing in comparison to other counties. So Marshall County has about half the population we do. Their case rate, or their 100,000 cases, would be 1,700 per 100,000. So that's quite a bit increased. Elkhart has 2,500 cases per 100,000 of population. Noble County has 1,500 per 100,000. Whitley and Wabash are less than us. Yeah, they have 500 and 596, but it still gives us an idea to see how we're doing in comparison here. One of the good news I want to emphasize today, this is not the pandemic I was afraid of in March. This is not the when we train on pandemics, one of the things that we look for is how it happens in waves. Now, I think we definitely flattened our wave since it was, we didn't want to see that huge hump that would crash our infrastructure. But now what we've got is, thank heavens, our death rate's only 12. I was afraid we would have hundreds in 2 months. I was afraid of 25% of our population being sick in a 2-month time scan. 20,000 cases compared to our under 1,000 cases is just so much more manageable. So we can all be very lucky. We're very lucky and very thankful that this is not as severe as what it could have been. Comparing it to 1918, we're just being very lucky here. So, okay. So schools are, of course, starting to open. We have had some things change with the communicable disease program. We want to wish Nicole best wishes as she begins school at Purdue. Doc R has asked her to continue to do the emails so that there won't be an interruption. People can have all that data. We don't want that to change right as school starts because we want to make sure everyone can get to those numbers. But with Nicole leaving, I have some new hires. I have Cindy Banta and Rosie Gonzalez have joined me in the communicable disease office. And it's kind of exciting because when I was interviewing them, I'm looking at them going, okay, we have school starting. This is going to be highly stressful. This is going to be, you're going to be quarantining people. They're not going to be happy. And their eyes lit up and they were ready to come help. So I think we're ready to take on this new challenge with the schools. So our mission for the month is to try to do everything that we can as the local health department to support the schools to stay open as long as that's safe and to help determine whether that's safe. So one of the things, how do you know if the schools are safe? I know I had some calls from schools where we have just a few in our population who lives there. There's some counties who have set rates on positivity that if they exceed this threshold, they intend to close schools. And we're not inclined to set something quite that hard because we want to make sure that we're looking at all the issues, not just one or the other. Right now, there are some cases involved with the schools. Of course, there's going to be people quarantined. None of those cases would look like they've obtained that at school. Even as we're looking at the cases that are happening in the older teens, there's a lot of outside activities that have influenced it. So that's one of the things that we're going to watch for is, are we having transmission happening inside of the schools, or are our cases infected because their parents have it and so they came down with it, or if they attended a social event that seems to be a common factor in several people getting sick. So that's one of the things that we're going to do to help make sure that schools are safe. Another thing that we're going to do in Kosciuszko County that we're kind of excited about because you're not seeing it very many places is we are going to track in the school-related cases how severe the illness is. We've created a breakdown, asymptomatic, of course, if someone was tested because they were exposed and they have no symptoms, and that's how severe their illness is. We want to know how many of our cases are the asymptomatic. Very mild, which we considered less than 4 days. You heal at home, you're fine, you're over it, and you wait out your 10 days to finish your isolation, but it was really pretty mild. A mild rating, which is something that's easily manageable at home and generally healed within 7 days. So again, we're looking at how severe are the illnesses that are happening, particularly in relationship to the schools, since that's something that we can gather. We're just starting out, we're just starting to get that data. Moderate illness would be if it requires more medical assistance. So if it's taking, if they have to have an antibiotic for a secondary infection, if it's taking more than 7 days to get over, we're going to track that. And then, of course, we would have a severe tracking, anything that required more intensive medical intervention, or if there was any hospitalizations involved, we're going to consider that a severe case. So when we get that data and we can put it out, we'll make sure that the definitions are included so that everyone can understand what we're looking for and what the severity ratings are. Because we think that's needed to have a picture of whether or not schools are safe to remain open, or if we need to close areas in the schools or close systems. We'll see what that is. So severity will be one of our markers. Transmissions in schools will be another one of our markers. Are we having ongoing transmission in school? How many cases? We haven't set precise numbers yet because we're going to look at that on a case-by-case basis and see. We want to take as much intervention as necessary to keep things safe, but we don't want to cause more disruption than we have to. So when we're looking at schools, we can do things like we can close a classroom, we can send populations home, we may close a school for a period of time. There's lots of ways this can be done, and our intention is to do this on a case-by-case basis to evaluate the safety. That'll be done with the health department and the schools, so we can make sure that everything, that's our goal. We want to be safe, but we want to create the least disruption as possible. And of course, if we see just too many cases, like we heard about Notre Dame, where all of a sudden they had this huge spike in cases. If you have something like that happen, the easiest way to get control of that is simply just to shut that whole thing down at that time and make sure that you stop that transmission. Next page. So we're working closely with all the schools. They've all been very active. We're in touch with all the school nurses. We have Cindy and Rosie are helping manage with all of the school calls. We're investigating the cases, tracking them, and then, like I said, we're going to add the severity, which will take a few weeks to get enough information to be able to put that out. And we're excited. It's a little scary, but I do want people to feel reassured right now. I am just so happy that this is not as severe and that we seem to have the ability to keep it under control right now, and we're going to get these kids back to school safely. The mental health, I don't know if anybody's seen, the CDC found that in young adults, 25% have considered suicide in the last month related to the impact of COVID. That's a horrifying statistic. And so we need to get everybody back so that we can be ready to function again and carry on with our lives and recover from this. There's lots of exciting research going on about pre-immunity and T cells, and I would encourage anyone who wants to geek out on COVID to go investigate the new research happening on T cells and immunity. And we're just going to hold on, take this one step at a time carefully, and get back to life.
Great. Well, thank you. I know, as I've said through this whole thing, your department has been such an invaluable resource for many different community partners, and I know there's no bigger reliance than the school on your guidance. And this is, I know, going to be a challenge, but I just appreciated hearing how you're setting up to handle it, and I agree we need to get back at it and try and be careful about it. So thank you, and I'm sure there'll be some questions on some of the details, but let's shift to local testing. I know Tina and MedStat have done a great job when we first called them several months ago to get some CARES Act testing going. We seem to have fallen off the radar of the state for state testing because our numbers weren't too high, and we were just kind of left here to fend for ourselves. And so as a result, MedStat stepped up and has done a great job. They've been subject to some of the fluctuations of materials and labs, and well, I'll let Tina go into that because that's why she's here. So, Tina, welcome.
Thank you. Yes, we have been excited to be a partner within the community to provide testing services and to meet the needs of the community. I know that this has been scary for many, and so again, we're glad that we're here and able to assist. As Mayor mentioned, we have definitely seen some changes over the last several months with testing. We've had an influx where we've had, initially when we started, we had a very small amount of supplies available to us to meet the needs of the community, and we've gone then in waves from there where we were able to readily receive supplies from our reference lab and be able to offer testing for the community. And then we went back into a period again where the labs were struggling to keep up with the capacity of testing. They've made some great strides where they've actually added additional capacities within their labs to meet those demands. And so with that, we've also then as a network, our hospital systems have come together, and we are working with a rapid product so that we can have testing available quickly and results same day for our patients. And so we're excited again to be able to do that. It definitely takes care of, or I think kind of helps to subside some of those concerns that parents have.
It helps a lot with the public health response also. It is just amazing the difference that we can have if we get those results right away and can take the actions immediately.
That's great. And honestly, that's the need for sure. We're excited that we have that available, especially with schools starting back up, so that we can get some of these kids who are experiencing symptoms, we can get them tested and determine what next steps are. Are they positive, negative? What do we need to do with the kiddos? Obviously, we work with the health department and the school nurses closely as well. And we're prepared as a network as well to handle that, and we're ready for assisting in that capacity. Our physician primary care offices have been working through and preparing so that we're ready to meet the needs of their patients. We're ready in the urgent care world, whether it's with testing or evaluating and seeing the students in the clinic as well. So we're prepared from that aspect as well. A couple things that I think can really help as we're, testing. Very important for individuals to schedule time on our website to come in. We, just due to the needs of the community, we had to go to kind of a schedule-based appointment type service for the testing. And so as long as people go onto our website, medstatonline.com, they can schedule a time when they can come in for the testing to be completed. And it's very important to, as the mayor mentioned, to complete all of that information, to include your insurance information if we will be submitting through your insurance, or if there's no insurance, then we'll utilize that COVID CARES money that the city and county have pooled together to assist with that. But getting that completed online and coming in for your service to be completed as close to that time that you've selected really helps. It prevents delays for all who are coming through to get those tests done. So that's a great piece for us that was really helpful. One thing that we're doing to kind of help as well, as we've completed testing, anybody who has a negative or non-detected result from the COVID, we're actually emailing those results to our patient portal. And it basically sends a notification to our patients letting them know results are available. And then they receive, they have a secure link that they can log into the portal and access that information. So that's been, I think, a great resource for our patients to utilize that. And then, of course, if we have someone who has the virus detected and or is positive, then we're calling and following up with them, as well as the health department, so that they're getting a lot of education. So hopefully they feel prepared to take care of themselves at home.
Okay, great. So I'm going to throw this question out to both of you because it's something that's been on my mind, and I've listened to a lot of people talk about this. What's a mother to do if the child has symptoms but tests negative? Because I know that the sensitivity of the testing is still somewhat limited, although it's as good as we've got, so we got to go with it. But if there are definite symptoms, and not just with school children, but anyone, if there are symptoms but they receive a negative test, then what do they do?
If they are symptomatic and receive a negative test, unless the doctor has an alternative diagnosis, they are out of school for 10 days. That's just the way it has to be right now. I know it's frustrating to parents who have this child that may not be very ill, but they just have to stay out for everyone's safety at this point. And that generally applies to everyone. If you have symptoms of COVID, it's expected that if you're not able to have an alternative diagnosis given, that you're to remain home and isolate for 10 days, even if your test was negative.
Okay. Tina, I know you talked about some of the rapid tests. I know we've got the availability at a rapid clinic we've got here, and I know you all are at the hospital and at MedStat have access to that. I know there's been discussion, Parkview mentioned that they may have that, and excuse me, I just saw on the news where there's a saliva test being developed that would give results within 3-4 days. I'm not sure where that's at and out to market, but you know, there seem to be pretty quick advances, and knowing that these rapid tests are available, how do you foresee those being utilized over the next 3-4 months?
Yeah, absolutely. So we're utilizing in our offices as a network, a Lutheran Health Network, we're utilizing those rapid tests for really all of our patients that we interact with. We want to find out right away what next steps are for the patient. Do we need to look for an alternative diagnosis? Do they need to be isolating and quarantining? We want to make sure that we're handling those quickly and handling those appropriately. The one thing that we have to be alert to, which just like earlier in the spring when COVID first came, we were limited on supplies. We are trying to monitor that and be alert to that, because at some point we could potentially be in a situation where we have a supply issue with some of our rapid testing, and so we have to be cautious with that as well. But currently we are opening up rapids to all of our patients that are coming through, just because it's just that important to get that information right away.
So CARES Act testing could be rapid testing as well?
Correct.
That's great.
Yep, correct.
Good to hear.
Yep.
With respect to the rapid tests, I know there was some rapid testing that I know Dr. Remington had talked to the state about because they weren't recognizing it because of that higher or lower sensitivity, if you will. I'm sure that's changed too, and that's why we update every other week.
It has changed, it has changed. Those now, the Sophia test, the antigen test, those trigger the public health interventions that were concerned before if those were going to be done. And, you know, initially the Kosciuszko County Health Department, we were trying to make up for that, but now the state recognizes those tests, classifies them as a probable case, and thus makes it so the call center from the ISDH side is notified and they begin that side of the triage. And then I forgot to mention, on particularly the school kids then, that also triggers it through us working with the schools at the health department to look for all those children that may be contacts and need quarantined. And I forgot to talk about this earlier, the difference between isolation and quarantine. So isolation is what we do for the person who has the illness, and that one is 10 days. Because we know that after 10 days, unless you have an immune system that's poor, you are probably going to be over this, and you're going to be feeling better, and you're not going to be able to transmit it to anyone else. So isolation is 10 days. One of the things that's confusing for families and parents is that quarantine, so you were exposed, you were a close contact of a COVID case, that's for 14 days. So, and the reason why is because it can take up to 14 days to show symptoms of illness. If someone is in quarantine and they start to show symptoms, then they get switched to isolation versus quarantine. And so actually sometimes in some families, especially with a rapid test, we can have the sick person getting out of their house and back to school before the other people who are there who are just exposed to them. Also, quarantine can be tricky because if you're not able to stay away from the sick person and provide that isolation, that quarantine extends 14 days from last exposure to someone who's contagious. So in the case of small children, if their parent's sick, their quarantine may last until their parents are no longer isolated, and then 14 days after that. So we understand that that is a rough standard and that that's difficult for our school families, but right now to open safely, this is where we have to start and this is the actions we have to take.
And I know that's been something that our employers too have had a lot of education on to try to understand and determine how do we navigate this.
Yeah, and that's a good point, because that's just another spectrum of this whole issue. You know, you got school, you've got your employers as well, and that certainly creates some difficulty, and that rapid testing, I'm sure, will be very helpful with that. You had mentioned, Teresa, that early on, the discussion of a standard pandemic was 2, maybe 3 waves. I distinctly remember that from that first meeting at the basement of the hospital when everybody was brought in saying, okay, this is what we think might happen. And that's kind of stuck in my mind. The way it's kind of playing out, it seems like there's been some bumpy roads, but not a big, not a double wave. But your thought was that that second wave would come potentially in the fall as the weather changed and flu became an issue. Can you talk a little bit about how you feel this may go? Just your prediction. We won't hold you to it from maybe when you first talked about it in March.
I think it's going to be really frustrating trying to sort out all the respiratory illnesses. Even at present, we have a presentation that's a little challenging. There seems to be a GI bug going around. And at first we were kind of like, I know in our office, we make theories and then follow them to try to see what's going on. So when we see a case and they have lots of, vomiting or diarrhea, and then we see more cases of vomiting or diarrhea, we're like, oh no, look at this COVID, and then we're getting negative tests back. So we start to get an idea that maybe the vomiting and diarrhea are a different virus and then this, at least one case had COVID. So trying to sort those out and the respiratory viruses are going to be even more difficult. Last year was a rough flu year. In about January, there were more positive school kids with influenza than I ever remember having seen before. It was influenza A and influenza B circulating at the same time. And I think that it's going to be very frustrating trying to sort this out this school year. And so hopefully those viruses will just hold off a little while and let us get our feet stable, and so we know how to watch for this and how things are going to change. We are also dependent, of course, on all the guidance because we're not a county alone. We are part of a state and part of a country, and all of those things impact our numbers even when we look at them as our little island here. So it's going to be rough this is going to be some rough times this school year trying to sort out, and the attendance that can happen with schools and the fact that we have to take kids out to make sure things are safe. You know, we're going to keep updating this and going as we can and sorting out what we can and learning so we know who needs to come out of school, what's appropriate, and build on that knowledge as we go along. And whether there's going to be waves, this is amazing. Like our wave, instead of peaking angrily, it seems to be long and slow, but it does extend it because it just circulates slower for longer. But it hasn't gone away all the way either.
Right. So obviously the discussion about other diseases and most notably the flu in the fall. You guys anticipating a rush for the flu vaccine this year? What are your thoughts on that? And then maybe follow up how you feel that plays into this whole thing.
Yeah, I do. I feel that there'll definitely be more people and parents wanting to get vaccinated, and I feel it's very important. You know, I've received the flu vaccine for many years personally, and I do. I think it's important, and it really does help, even if the vaccine, as it's put together and determined for the season what it should look like, even if it's not 100%, it does help to reduce symptoms and protect. So it's very important for people to get the vaccine, and yeah, I would strongly recommend it.
Yeah, that kind of goes along with what Teresa said about, you know, you get an illness, you get a symptom, and all of a sudden you start thinking COVID. If we can minimize those symptoms by eliminating some strains of flu with the vaccine, I would assume that's the whole point here.
Yeah, it definitely you know, that's the goals in mind. I know the Kosciuszko County Shot Clinic has moved to appointments now. That's a little different than it has been in years past, but I think it has a lot of advantages for people, you know, having that scheduled time, knowing what you got. The nurse is able to really focus, not having a big waiting room full of people waiting on them. And so if people do want to visit the Shot Clinic, 267, oh, I've had a brain ditz. Okay, let's try 372-3515. So, and they can help set you an appointment to get you set up for your flu shot or any of your other immunizations that you need. If you need to ask some questions about where you might be in your immunization status, they can help you. By going to appointments, that has helped eliminate that lots of people in the waiting room, so that we're decreasing the risk of infection to people as they come in, and can keep those appointments much more brief in their duration.
Great. Well, let's open it up. I know I've got absolute authorities here that are going to make my job easier today. I assume they'll take the questions, but Dan, I saw you raise your hand, so if you want to come up to the microphone.
Is this one out?
I don't know. I hope it is.
Testing? You don't know me.
No.
I'll speak loud.
All right, speak loudly and I'll repeat it.
I believe that you mentioned there have been some cases already involving students. Do you have any numbers? First off, was that accurate? Do you have any numbers?
Dan Spalding wants to know if there are already some cases in the schools. Is that accurate, and are there numbers?
I think most of the cases involved around schools, were actually before school started. I mean, so they come into our numbers because they were diagnosed in the time frame that we set, but they weren't in school when they got. But I'll tell you what the procedure is. When we do have a positive come back from the schools, what the school does is they look for those close contacts. They're looking for that 6 feet or less, 15 minutes or more, and they're examining those, and once they get that contact list. Once there's that contact list, we help the schools contact those families and talk to the parents, let them know, that there's been an exposure, their child was a close contact, and that they are expected to remain out of school for this duration of time. Then we follow that up by sending them an email that gives them the specifics, that gives the dates the last date that they were exposed, the date that they are to return or after they can return after, and then some of the handouts from Indiana State Department of Health so that they have all that reference material right there so they can look it over too.
So you're already seeing that play out, obviously.
Actually, we started using that method before schools were even in, partially as a trial, if we had school-age kids. For probably 6 weeks, when I walk in the morning, I like to get there early. I print my list to see how many new illnesses we have. And like I said, for quite a while here, I've been taking a highlighter to it to look for anybody who is school age. So we had a feel for how many of the school-age children were being affected before we started into the school year. And so we could make sure that we're taking the actions that we need to.
Okay. Nick?
Yep. Teresa, you mentioned early on that you thought back in March that this thing could really blow out of proportion at times, and today we've noticed that things, as you mentioned, have been kind of going on like a roller coaster effect with the waves. What do you think has been a big contributing factor to us locally that we haven't had as big of an outbreak that you thought originally? Does it have to do with anything centrally, maybe with our surrounding neighbors as well? What would you say has been some big roles in that?
There's a lot of things that impact that. Along the way, as I've congratulated our businesses for being proactive, it has been a long time since I've had any business in Kosciuszko County that made me mad. So once they knew what to do, everybody's pretty much done it. Even a lot of the population has been remarkably compliant in what they've been asked to do. People here have been, I know with the state testing site, they said that there was a lot more people here who were willing to come through and be tested than in Elkhart County. They made a comparison there and said, wow, people are really interested here. So I think we have, a good population. We've had some good businesses. I certainly know from the health department standard, we try to be very aggressive in making sure that we follow up on things timely. We don't want to let things sit and want to try to make sure, early in the pandemic, we came in all the time to check those, because when you don't have a lot of cases, that case management and pulling people out of the population at that point, getting them isolated, doing the quarantines, in the beginning, that makes a huge difference. Or when the case numbers are low, the more you're able to keep that tightly managed, the less spread you get. But it's really been an all hands on deck that's made our results be as good as they are.
I did have a question about contact tracing in schools. When a case comes up, I know you talked that you've got some extra help to handle that. How does that dovetail with the state's contact tracing? And kind of a part of that question, when a lab someone tests positive, does the lab send that result directly to the state or to the county health department or to you, and then you do it? So what starts that ball rolling? And then at the point where it's potentially a student, I know you guys are kind of set up to really get in there and get it done as quick as you can. So kind of talk a little bit about that.
Yeah, so if we do a send-out test, the lab that we send the specimen to, once they have results, we basically receive them at the same time those results are pushed into the state system. So we're both being notified at the same time. And so then that process can begin from there. Any of the point of care or rapid testing that we do, our team has to load that data into the state system. And so that's loaded within a few hours so that that information is in there and available.
So then, how do you get made aware of positive tests in the community? Through the state? Does the state then contact you?
They don't contact us, we monitor, that's like the report I print off
see.
in the morning. It's NBS, which is the national-based system, is Indiana's acronym for it. It's the electronic surveillance system that most of my job gets done within. So we look for those cases there. We also, because right now with schools, the parents are often the first to know because they find out at the appointment or shortly thereafter, and they give the school a call. When the schools, whichever way we get the first information, that's what we start on. If we have the information from the school, we may want to verify that the case is really positive. It may take a phone call, it may just take looking in the database. And so we start those calls. The state starts from a different side. Their call center starts from the lab, so they see the positive, it gets reported in, and it goes to their call center in MS Dynamics, and they pursue the contacts from there. So we actually have kind of a dual overlapping here. Once we do the calls with them, then we enter the information into MS Dynamics, basically so we can use the state call center to do the longer-term follow-up on the quarantined patients, so we can take that off our, we're able to run a lot faster. We know about the results a couple of days before it usually hits MS Dynamics. We actually have to wait to get our data to put it into MS Dynamics because we've known about it, we've done the quarantine, and we just have to wait for the electronic paperwork to catch up. So, and that's our goal, is to keep trying to be that speedy so we can hopefully keep our numbers as low as possible.
Okay, thank you. Mr. Spalding?
Yeah, just a few quick questions. Will the county has been great about these statistics you've been providing. Will the county provide any specific school stats and specifically the symptoms, which would be really telling and interesting?
So Dan's asking if the county will be providing statistics for specifically school cases. Is that correct, Dan?
Yes.
Yeah.
For specific schools or our schools in general?
Schools within the county?
Schools within the county, absolutely. That's what we want to do is, and we'll look for, I hadn't quite thought of breaking out which symptoms, but we're still at a point we could probably still go grab that data and include it. And that's a good idea, symptoms. And then, like I said, along with that, we want to pair the severity because there's a big difference if you have an 18-year-old who had a stuffy nose and a sore throat for 2 days versus one who ended up getting pneumonia. And so, but yes, on a county-wide basis, it's our intention to release that data once we have enough.
Also, your information on isolation and quarantine was really interesting. What about people coming back from a hot spot? How long should they?
When people call us, we often look that up and kind of advise them on a case-to-case basis. If someone was maybe traveled and they don't know that it was a particular hotspot, but they say, what can I do to help make sure that I don't bring this back to someone? If they can't really quarantine, then I tell them to keep that mask on a very diligent basis. That's the person where, irregardless of what's going on, I want that mask on your face. If they were coming back from a hot spot and we don't want to maybe take them out of their job for 2 weeks. If you work in your own office, that's not a major risk to others, but anytime you're going to be around someone, if you're close contact, we don't want you there. But if you're not quite a close contact, but we're worried about it, that's when we really want the mask on.
Also on people who show symptoms and get tested, is it accurate to say that those people will get rapid results?
Yes, that's correct. Those are the tests that we're doing for most all of our symptomatic and exposed individuals.
Okay.
But if they don't go, that's what MedStat's doing, so it does sometimes depend if they go to a different provider. I still have had people that I sent back to work before they ever got a result. And once again, then they can go back to work. I can, look at the time based of symptoms and get them a work release. And then sometimes, we're like, well, glad you're back to work. I can finally see your results in the system. And so if people do have problems with their results, if they're a Kosciuszko County resident, we should be able to see those results if they are having problems, and we'll look them up and see what we can do.
Okay. One final question. What do you think of gator masks? I'm hearing some criticisms about it.
The biggest thing, I have heard some criticisms. I know there's some people who were pretty aggressive with that over the weekend. I saw that we were out of town and we saw some people be scary. One of the things that's always been said is that they do want multiple layers of fabric. And so some of the gaiters, if they're only one layer, is pretty thin. So I've read part of the research. The honest truth is, a year ago, a lot of us professionals would have argued pretty loudly with each other about whether or not cloth masks were effective. So yes, we're going there and we're learning a lot. I know in history it started with cloth masks. Of course, they are probably effective. The thicker the mask, to some degree, the more filtration you're going to have. Are you trying to protect yourself, or are you trying to protect others? So a gaiter is at least going to help confine those droplets. It's going to make it so they don't have a big cloud coming out of their mouth in the same way that you might have if you didn't have anything over your mouth, since you kind of have a tissue over it already. So it may not be absolutely perfect, but I would encourage people to not necessarily accost everyone in a gaiter. Because that's just not very fair. And sometimes the gaiters can be folded in half and they can have 2 layers. So there's different things people can do, but you can find a lot of research out there on the masks that'll go either way.
Thank you.
All right. Dave, anybody else?
Hear my question.
Okay, gator masks, all right.
Well, the school thing, like if Lincoln Elementary had 10 positives, would we know it was specifically Lincoln Elementary? Or would you just say more?
I bet that would leak.
Dave Stone wants to know if there would be specific statistics given for specific schools, to which Teresa replied.
It might leak. I'm pretty sure social media would have that out all over. I do encourage people to know that social media often has a little bit of truth in it, but a lot of times the details are just not related to what's happening. If people do have concerns, we can't share everything. We want to protect everybody's privacy in the appropriate manner. But if people do have questions or concerns, we are available in the communicable disease office. Main line's 574-372-3517, and we'll try to help, even if you see something that's just wild, or sometimes it's nice to know if there's wild stories out there, because we're going to get calls later. So let us know and we'll try to help, and we'll reveal what is appropriate, and we want to be as transparent as possible while protecting privacy.
All right. Tina, any final thoughts from the testing side and MedStat and KCH?
No, I don't think so. Thank you guys for your time.
Yeah, good. Appreciate you coming. Like I said, I felt very supported today by the great experts that we've got here. And again, that really is the purpose. I think we've seen COVID has changed from what we thought it was to what it is, and to who knows what it's going to be. But hopefully we're heading in the right direction. With that, again, this will conclude today, but I just want to remind you that we're going to stay on a kind of a 2-week schedule, at least for the time being. And it looks like primarily we're looking at updates, health updates, and others that we can get in here, and anything that's timely. So we will have our next presser in 2 weeks from today. All right, thank you all.
Thank you.
Okay, well, thank you all.